Hi, it's Dr. Jeff, and I'm going to talk in this video about ROFit, the NeuroFit approach to treating a pulled hamstring or chronic hamstrings, and how to fix it and prevent it from happening again, hopefully. First, why do people constantly get hamstring pulls? They usually constantly pull a hamstring because, one, they're not treating the true source or maybe origin or contributing factors of the hamstring pain, meaning they're only treating the injury site itself and not other contributing areas. And secondly, they're doing the wrong rehabilitation, meaning they're rehabbing the wrong muscle, mainly the hamstring. So let's just take the approach, like we'll just kind of walk you through, like if you're coming into our office with a pulled hamstring. So you came into our office, you got pain in the hamstring, maybe a little swelling, maybe a little edema. We muscle test the hamstring, it's weak, okay? It's a common hamstring, okay? Now, what we're gonna do is, first thing what we're gonna do is lay you face down on the table, okay? So you're laying down on the table. We take one hand, put it over the glute muscle, another hand over the hamstring muscle, and another over the low back. And what we have the patient do, or you do, is we want you to extend this leg. And what we're looking for is muscle activation. So, if I have a hand on the glute, the hamstring, and the back, I should feel this glute muscle tighten up first. When I ask you to extend that leg up, you're laying on your stomach, I say keep the leg straight, pull the leg back. I should feel that glute to contract first. A lot of times that hamstring is contracting first. And the glute muscle is the prime hip extensor. So, if right there, if we have you laying down here, and I say lay down on your back, straighten this leg, and that hamstring contracts first. What that means is the glute is not doing its job. And the glute is the prime extensor of the hip, but the hamstring's doing it, okay? So the hamstring's strong, and it's doing the job of the big glute muscle. So most people will think that the hamstring's weak, when exactly what's happening is the glute isn't firing. The next test we do is have the patient lay on their side, extend their leg, point the toe down, and basically what we're doing is we're checking the gluteus medius right here. And what we should feel, or the patient should feel, is just the burning over that gluteus medius. So when they're doing abduction, if they start feeling tightness or contraction in the quads or glutes, that means muscle compensation is going on, okay? And again, that just means that the wrong muscles are initiating the right movement. So one of the main reasons that you're constantly getting the hamstring pain is because you're not treating the true cause, which is the muscle activation or the other source of the pain. So we know now, let's just say that happened. The hamstring contracted first, and when we had the person on their side and tested the strength test their gluteus medius, they felt compensation, okay? So we make a note of that. Now what we need to do is we use a specialized muscle stimulation called the Phoenix Waveform, and we use what's called our hunt technique, where we take an electrode pad and we run electric current through the pad, and what we basically do is we hunt all over the hamstring, all over the glute, the tensor fasciae lata, just the front erectus femoris. And what we're looking for is we call like a hot spot, which basically when we go over that area, we'll feel an increased sensation or discomfort. And what we know, those are related to the hamstring injury. So what we'll do is we will mark areas that we have found on the body. Okay, so basically we've used what we call our hunt technique with our Phoenix Waveform, and we identified, let's say, 4 hot spots where when we went over those areas, the patient went, whoa, that is really uncomfortable. So now what we do, so now we know a couple things. We've identified some other sources of origin or contributing factors of the pain, and we've also identified a misfiring of the glute and glute medius, right? So what we're going to do now as far as treatment, most therapy places, they're going to, you pull the hamstring in here, they may use some other type of muscle stimulation and just put it over that area for a little bit, and then they may have you do hamstring exercises because you pull the hamstring and the hamstring's weak, right? Well, that's not right. And that's why they don't respond, they take longer to respond, or you constantly get pulled the hamstring. So, again, we've identified our hot spots that may be away from the area of the pain, and we've identified that the hamstring is contracting instead of the glute, and there's compensation taking place in the glute medius. So, what we're going to do is we're going to put our Phoenix Waveform over these areas of the hot spot. We're going to run the electric current through there, and we're getting a strong contraction, and then we're going to take the patient through an eccentric, where we have some extra mobility exercises that the patient's going to go through. So we're identifying those hot spots. Then what we do is we need to do proper rehabilitation. So most of the time the hamstring is strong. It's the glute medius or glute maximus that's not doing, their job. So what we're going to do, so now even if you just do traditional exercise on the glute medius and the glute maximus, if the hamstring, you just have them do hip extension exercises, but the hamstring's contracting first, you're just reinforcing bad movement patterns, okay? You're really not addressing the problem. So what we will do is we'll take our specialized Phoenix Waveform, and we will put pads over the glute muscles, and let's say the glute medius muscle. And what we will do is we will cause a contraction in the proper muscle, and then have the person do hip abduction for the glute medius or hip extension exercises for the glute maximus. So what we're doing is we're training more the neuromuscular connection. So by applying electric stimulation here, that is going up and making connection with the brain. We are trying to re-establish this communication and initiate the right muscle to work. So we're doing proper now exercises on the glute. So we haven't even addressed really necessarily the hamstring yet. And so we're doing the proper neuromuscular re-education exercises by stimulating the proper movement to initiate the right movement. Then after that's done, then we go, because there is an injury to that hamstring. There is, let's say, a mild little tear there, there's some swelling, there's some edema. We will surround the area of the injury with the Phoenix Waveform and run currents through there, and then we will also probably end with some type of microcurrent that has been shown to enhance the healing. So again, most hamstring injuries reoccur because they aren't identifying other sources or origins of the pain, and they're doing improper rehabilitation by maybe just focusing on the actual hamstring exercise, when again we need to look into the glute medius and glute minimus and get those activated with the aid of some type of electric muscle stimulation, like the Phoenix Waveform that allows us to do that. Lastly, what's very helpful is getting on yourself some essential amino acids, ketone aminos or master amino pattern, and also some magnesium, taco magnesium gel. The magnesium gel, you rub into that area, let that muscle absorb that area. And then the amino acids really help with tissue repair and strength and growth. So if you're constantly pulling your hamstring and you're not doing some type of activation of the glute to glute medius, you're just setting yourself up some more injuries, more